We know that there is variation in the typical use of mazes in people. Are there qualitative differences or quantitative differences that you use to differentiate between what's typical and what's atypical?
So when we're thinking of what's typical and what's atypical, we're really thinking about, are the mazes interfering with the message getting across in the communication consistently? And that's why I talk about looking at mazes and narratives, of course, as one part of your diagnostic decision making, looking at all of your converging evidence. Everybody uses mazes with different frequencies and for slightly different reasons. For a bilingual child, I'm really looking for, are they using the mazes to help them to assist with the content of what they're saying? And if so, sometimes that's going to vary in frequency. Is a child using a lot of mazes but still not getting their point across? A lot of times that can be indicative of more of a linguistic challenge in organization. And that's something that we'll talk about. And a lot of times those kids can actually benefit from sequencing vocabulary help, etc., to try and help them organize what they want to say. And then a lot of times we can actually see some reductions in the amount of, for example, verbal hesitancies or mazes that we see in their language. So for me, it goes back a lot to the purpose and are they successful in communicating the message? And that's what's going to help me determine whether or not the mazes are indicative of a bigger linguistic challenge.